by is the Premier of KwaZulu-Natal, Mr. Sihle Zikalala, to talk us through his observation and let us know in terms of hotspots in the province, what they're concerned about. Bab Zikalala, thank you very much for your time. So my colleague is at beaches in KwaZulu-Natal, and we're seeing people without masks and out in their numbers, an issue of concern, especially since the province is the epicenter now.
Well, thanks. Yes, we are quite concerned about the number of people who are found at the beach, walking around, and others swimming. And most of them, you will find that they are not following the regulations, especially they are not complying with wearing of masks, which is quite a worry. In terms of being the epicenter, we are, of course, worried about the increase of numbers. But, of course, we keep fluctuating. You find that we will be number 2, number 3, but mostly we will always follow Gauteng. As of today, Gauteng is leading. Yesterday, KwaZulu-Natal was leading. The new cases recorded on the 19th of December are 4,135. And most of them come from areas like eThekwini, uMgungundlovu, and Ilembe. And those areas are your like economic centers in a main.
And in terms of interventions and vaccination in these areas, where are we sitting?
Right now, we have vaccinated more than 1.1 million people, which does not reach, of course, the target we are aiming. It represents something like 58%, and we need to move on to reach 70% and ensure that we achieve the herd immunity, which we believe we will reach. We have established the good relationship and partnership with various stakeholders, the religious sector, the traditional leaders, the sports fraternity, to ensure that all of us talk in one voice to encourage people to ensure that they vaccinate.
In terms of hospital admissions?
Hospital admissions are still a problem, but there has been an increase in terms of the number of hospital admissions, both in public and private. But in terms of our public facilities, we have more than 3,000 beds for isolation. There are 3,355 for isolation and 1,533 beds reserved for people who are under investigation, and 117 for people who require the intensive care unit. Right now, we can say that the occupancy rate has not reached more than 40% of what we have. If also the situation is getting overwhelmed, we will repurpose our field hospitals and other hospitals to ensure that there is enough beds to accommodate that those who will need such service.
Given that people are not using non-pharmaceutical ways to stave off infections, especially as we saw at beaches in that province, what to do?
We will have to be strict in terms of regulations, especially at the beaches, ensure that people are adhering to non-pharmaceutical measures, ensure that all people who comes to areas like the beach and others wear masks. We are working with municipalities to enforce that, and we are also working with the municipalities, the police, to ensure that we deal with crowds, because we don't want to see people being crowded in one space, because we don't want anything that will tend to be a super spreader.
Is a harsher lockdown a way to go, you think?
Well, I don't believe that we must go to a harsher lockdown, but we must work to ensure that people get vaccinated, and we must be strict on adhering to non-pharmaceutical measures.
Thank you very much to the Premier of KwaZulu-Natal, Mr. Sihle Zikalala.